When you get a cancer diagnosis, the world can pretty much stop for you. Then it gets into a fast track as you figure out the treatment.
A new form of radiology is being used in Fresno. Radiology oncologist Dr. Liu is here now to tell us all about it. Dr. Liu, thanks a lot for being here.
Oh, I'm glad to be back.
Can radiology treat all cancers?
Most of the cancers require we call multi-modality therapy, so which involves surgery, radiation therapy, and chemotherapy.
Okay.
And in some cases, we use radiation as a single treatment to cure those cancers.
Okay.
Like a stage 1, early stage larynx cancer or some lung cancer.
Oh.
Yes.
Now, you use the IMRT machine on Kim's husband who had throat cancer.
Correct.
Now, some state-of-the-art technology used at UCLA and other locations. How is that going?
But now you're using TrueBeam, which is even better than that.
It's a great improvement.
Right. And the TrueBeam is the cutting-edge technology. It truly revolutionizes the way we fight cancer. It allows us to maximize radiation to cancer while minimize exposure to healthy tissue like never before.
And we thought all the other radiology machines did that. They were that precise. I mean, this is a teeny tiny little beam.
It's a teeny tiny thing, exactly. If there's one machine that does it all, that's TrueBeam. Not only we can use TrueBeam to do conventional radiation therapy, we have to keep in mind that conventional radiation therapy, what we're talking today, was unthinkable 10, 20 years ago. So on top of that, we can use TrueBeam to do what we call stereotactic radiosurgery. So we give ablation dose of radiation to deep-sided cancer without damaging the healthy tissue, or with very little damage to the healthy tissue. It's just like removing the cancer surgically without a scalpel. Just one single treatment.
And that's it?
That's it.
Boy, this really, I'm assuming this also increases the survival rate.
Absolutely. Yeah, with very little discomfort. And the treatment usually takes about 2 to 3 minutes. That's it.
But you have to catch it at a certain stage?
Correct.
Okay.
Yeah.
You can't progress to on down the road, so to speak, stage 3 or 4.
Yeah, stage 3. Actually, we do use a stereotactic radiosurgery to treat stage 4 patients for like a comfort measures to improve their quality of life. Especially like someone with metastatic disease to like a spine or brain. And in the past, we have to give them 2 to 3 weeks of treatment. Now it's just one single treatment. We can relieve their pain and improve their quality of life.
Well, that's so important even when you're in that position.
Right.
You know, a lot of times people say, oh my gosh, you've got this terrible disease, you have to go out of town. You've got to go to like what these big names, Kobe